A new wave of alarming claims has placed the British royal family under intense scrutiny. According to reports and alleged royal insiders, serious questions are once again being raised about the health of King Charles. Some claims have gone even further, suggesting that the king's cancer may be incurable and that he could be forced to live with the disease for the rest of his life. However, these claims have not been officially confirmed by Buckingham Palace, and that distinction is extremely important. But as speculation continues to spread, attention is now turning toward one critical question. What happens to the monarchy if King Charles becomes too ill to carry out his royal duties? The possibility has immediately placed Prince William at the center of the conversation. As the heir to the throne, William has spent his entire life preparing for the day when he will become king. But preparing for the crown is very different from watching your own father struggle with a serious illness. That is the difficult position William could now find himself in. As a son, he would naturally want his father to rest and focus on his health. But as the future king, he must also be prepared to ensure that the monarchy continues to function if Charles is unable to perform some of his responsibilities. This creates an incredibly delicate situation. If William takes on more royal duties, it could simply mean that he is supporting his father during a difficult period. But if his responsibilities continue to increase, some observers may begin to wonder whether the royal family is quietly preparing for a much bigger transition. And there is another senior royal whose role could become extremely important: Princess Anne. The Princess Royal is not only King Charles's sister, but also one of the most experienced and hardworking members of the royal family. For decades, Anne has remained committed to royal duty through some of the monarchy's most difficult periods. Now, if the claims surrounding Charles's health prove to be serious, she could find herself caught between two generations. Her brother, the king, who may be determined to continue serving despite his illness, and her nephew, Prince William, who may have to accept greater responsibilities sooner than expected. For Charles, stepping back may be emotionally difficult. He spent decades waiting to become king. His entire public life has been built around the idea of duty and service. So reducing his schedule may feel like much more than a medical decision. It could feel like giving up control. And that is where the emotional tension inside the royal family could become even more complicated. Because every canceled engagement and every responsibility transferred to another royal can send a powerful message. It may simply be a temporary adjustment. But to the public, it can also look like the monarchy is slowly learning how to operate without the king at the center. That is why every move involving Prince William is now being closely watched. If he appears at more events, people will ask why. If he takes on more constitutional responsibilities, speculation will grow, and if senior royals begin discussing contingency plans, the questions surrounding the future of the crown will become even louder. But it is important to understand that preparing for a possible scenario does not automatically mean that the king is about to abdicate, or that the throne is about to change hands. The British monarchy has systems designed to maintain continuity if a monarch becomes temporarily unable to perform certain duties. Still, even discussing such possibilities can be deeply emotional for the royal family, because behind the constitutional rules is a family facing a very human fear: a son watching his father become vulnerable, a sister watching her brother struggle with his health, and a king trying to continue serving the country while facing a future he may not be ready to accept. For Prince William, the situation may be especially painful. He has always known that one day he will become king. But no son wants to feel that the day is approaching because his father is becoming seriously ill. And perhaps that is the greatest tension at the heart of this story. The question is not simply whether William is ready to become king. The question is whether King Charles is ready to see his son take on a role that he himself spent his entire life waiting to inherit. For now, the most serious claims about Charles's condition remain unconfirmed. But the speculation has already raised questions that the royal family cannot avoid forever. Because if the king's health continues to deteriorate, the balance between father and son, between the current monarch and the future king, could become increasingly difficult to maintain. And that is where the story takes an even more dramatic turn. Because the real struggle may not be about who will eventually wear the crown. It may be about how much responsibility Prince William is forced to accept, while his father is still wearing it. The question now facing the British royal family is no longer simply about King Charles's health. It is about what his condition could mean for the future of the monarchy. If the reports surrounding the king's health are accurate, Prince William could gradually find himself taking on more responsibilities. But that transition would have to be handled with extraordinary care, because Charles is still the king, and William is still his son. For William, this creates a painful contradiction. He must be ready to step forward when the monarchy needs him. But at the same time, he must make sure that his father never feels as though he is being pushed aside. That balance could become one of the greatest challenges of William's life. The Prince of Wales has spent years preparing for the responsibilities of the crown. But there is a major difference between preparing for the future and being forced to confront it unexpectedly. William may be ready to become king one day, but that does not mean he is ready to lose his father. And this is where Princess Anne could become one of the most important figures in the entire situation. As Charles's sister, Anne understands the king on a deeply personal level. As William's aunt, she also understands the enormous pressure placed on the next generation. Her role could be to help both men understand something that may be difficult for them to accept. Charles accepting help does not mean he has failed, and William taking on greater responsibility does not mean he is replacing his father. The monarchy, after all, is designed to survive difficult moments, but the people inside it are still human, and that is where the emotional struggle begins. For years, Charles has built his identity around service. He waited decades to become king. He wanted to use his reign to make a difference. So the idea of slowing down because of illness could be incredibly difficult for him. Every canceled engagement could feel like a personal loss. Every responsibility handed to William could feel like another reminder that his health is changing the way the monarchy operates. But William may see the situation differently. For him, protecting his father could mean convincing him to step back, to rest, to accept medical advice, and to allow other members of the royal family to carry some of the weight. That difference in perspective could create tension behind palace walls. Not necessarily a battle for power, but a battle between a father's determination to continue and a son's determination to protect him. Meanwhile, the wider royal family would have to adapt. If Charles reduces his public schedule, William could become more visible. Princess Anne could take on additional duties. Other working royals could be asked to represent the crown at events that the king can no longer attend. To the public, these changes might appear practical, but together, they could create a much bigger impression. That the monarchy is slowly preparing for a new era. However, it is important to emphasize that there has been no official announcement that King Charles is preparing to abdicate, and the most serious claims about his health remain unconfirmed. Any discussion about a possible transfer of power should therefore be treated as speculation rather than established fact. But even without a formal transition, one thing is clear. The conversation about the future of the crown has already begun, and Prince William is at the center of it. He is the man who will eventually inherit the throne, the man expected to lead the monarchy into its next chapter, and the man who must now potentially prepare for that responsibility while standing beside a father whose health has become a matter of international concern. That is an extraordinary burden, because when William eventually becomes king, the world will see the crown. But William will remember the man who came before him, his father, the king who spent decades waiting for the throne, the king whose reign may ultimately be defined not only by what he accomplished, but also by how he faced the greatest challenge of his life. For now, King Charles remains the monarch. Prince William remains the heir, and Princess Anne remains one of the key figures holding the family together. But if the situation surrounding Charles's health becomes more serious, the balance between these three generations could change dramatically. A son may have to become a leader, a brother may have to accept his own limitations, and a sister may have to stand between them, protecting both the family and the institution they represent. The British monarchy has survived wars, scandals, political crises, and the loss of beloved monarchs. But this time, the challenge is deeply personal, because behind the crown is a family. Behind the titles are human beings, and behind the questions about succession is a son who may simply want more time with his father. For now, the future remains uncertain. The most serious claims remain unverified, and there is no confirmed indication that the crown is about to change hands. But one thing is certain: the world is watching King Charles. The world is watching Prince William. And the world is watching the British royal family as it prepares for whatever comes next. Because when the time eventually comes for William to wear the crown, his greatest challenge may not be learning how to become king. It may be carrying forward the legacy of the father he never wanted to lose.